Hi, everybody. My name is Leah Gropo. I'm one of the registered dietitians at Stanford Healthcare, and I'm just so fortunate today to be able to introduce to you all Mag Ford. She's one of our nurse practitioners at the endocrine clinic at Stanford Healthcare, and she does such a phenomenal job. Her patients rave about her, and so we're so lucky to have her to teach us a little bit about exercise. So starting our 2021 off with some exercise. So without further ado, I will turn it over to Mag. Oh, one more quick thing. If you have any questions, feel free to put them in the chat and I will ask them to Mag so she can answer them in real time. Thank you all again for joining us to our wellness series with diabetes at Stanford Healthcare.
Great. Thank you so much for the kind introduction, Leah. I'm really honored to be here today to speak on this very important topic. As Leah mentioned, my name is Mags, and I'm one of the nurse practitioners here at Stanford. And so just as an introduction, today I will be talking a bit about how to start the new year off right with morning exercise, and just in general talking about exercise, diabetes, and how implementing routine exercise can be beneficial for diabetes. And of course, if there's any issues with the audio today, feel free to type into the chat and we'll troubleshoot. But again, really nice to see all of you virtually today. So today our objectives will be to first understand the American Diabetes Association's guidelines regarding exercise and diabetes. Secondly, to learn about the impact exercise has on your blood sugar and various exercise, anaerobic and aerobic. And then also lastly, our goal is to also brainstorm creative exercise options together, including some at-home options while we're all sheltering in place during the COVID-19 pandemic. And so this is a nice summary of guidelines for recommendations for exercise for patients with diabetes. And this is all per the American Diabetes Association. And so in general, and I'll refer to the American Diabetes Association as the ADA. So in general, per the ADA, recommendations call for 150 minutes of accumulated physical activity each week. And this can come out to about 30 minutes per day for 5 days per week. But of course, feel free to distribute this throughout the week to whatever works best for your schedule. I know we're all very busy, and so some exercise is better than none at all. But this is just a general guideline and a good goal as a starting point. Secondly, we recommend no more than 2 consecutive days off each week without physical activity. So this means that, say, it's okay to take Saturday and Sunday off from exercise. Say you want to take a couple of days off on the weekend. But if you do that, we wouldn't recommend taking Saturday, Sunday, and Monday off. Really important to try to be mindful of the days that you are taking off and that they do not exceed that more than 2 consecutive days. Third recommendation is that we do recommend resistance exercise or strength training 2 to 3 times per week. And then the recommendations are a little bit for children and adolescents. So we recommend, let's go back one moment. Let's see. Yeah, so for children and exercise, we recommend, children and adolescents, we recommend 60 minutes per day of exercise. And so I'm going to go to the next slide. So this is also just a nice summary of not only the exercise guidelines that I talked about, but also some other lifestyle implementations that we can all try to incorporate into our life that can help with, of course, our diabetes and also just improve general health and quality of life. So as I talked a little bit about exercise guidelines, in particular, patients aged 18 through 64 years of age should be physically active each day and minimize sedentary lifestyle and behavior. But of course, these guidelines can also be applied towards adults over the age of 65, but we want to modify exercise to meet our physical abilities. And if we have any sort of limitations, we don't want to do what we're not capable of. And so starting slow is always a guideline if we are new to exercise. Sleep is also very important for improving quality of life and health. And so trying to aim for 6 to 9 hours of good quality sleep on a regular basis with consistent bed and wake up times. Having a routine schedule can really help with improving sleep quality. As I also mentioned, trying to limit sedentary behavior and sedentary time to 8 hours or less. And this also includes limiting screen time, recreational screen time, to no more than 3 hours. Of course, many of us work in front of computers, and so the time we spend in front of computers at work is unavoidable. But we want to be mindful of the amount of time we spend in front of a screen outside of work. And then also just trying to be mindful of how much time we're spent sitting at a desk. Many of us are now working from home with the pandemic, and I have heard from some patients who have opted to purchase standing desks, which can convert from sitting to standing, which is kind of a nice way to incorporate standing more into our daily routine if that's something that you feel you're able to do. Let's see. And then I did talk a little bit about exercise recommendations. Generally, we call for 30-minute sessions at least 5 days per week. But again, we want to individualize the recommendations to meet our abilities. And so I did talk a little bit about guidelines per the ADA for exercise, but I want to talk a little bit about the benefits to exercise and why these guidelines are in place. And so regardless of diabetes, there are some benefits for all of us with exercise. Exercise can not only help control weight, lower blood pressure, lower cholesterol, both the bad cholesterol, LDL, and triglycerides, but it can also help us rise our HDL, the good cholesterol. And all of this can ultimately reduce cardiovascular risk of a cardiovascular event, such as a heart attack or stroke. It can also help strengthen our muscles and bones, improve just mental health, which is equally as important as physical health. And so improving mental health and reducing the risk of cardiovascular disease. Talk a little bit about the benefits in regards to diabetes and how exercise can help improve diabetes and glucose control. And so one of the biggest effects of exercise is that it will lower your blood sugar. And this is through a variety of mechanisms. One of the most predominant mechanisms is that exercise increases insulin sensitivity, meaning that your body is better able to respond to insulin. Insulin, of course, is a hormone that is responsible for helping bringing glucose into the cell. But what can happen in particular with type 2 diabetes is insulin resistance, where sometimes our body is still producing insulin, but our body is not responding very well to the presence of insulin. And so exercise can help improve this process by increasing insulin sensitivity, which will ultimately help reduce glucose level and then also help reduce insulin requirements if we are on insulin therapy. And then also diabetes or exercise can also help glucose control by just reducing blood glucose. Essentially what happens when you are exercising, your muscles contract during activity and your cells do require glucose. Your cells in the muscle have to take up glucose to use it as an energy source. And the process of this glucose being brought up by the muscle cells will help bring down the serum or blood glucose level. And then over the long run, routine exercise can ultimately help reduce our A1C level, which is often a goal of less than 7% or less, 7% or less. But of course, this is individualized from patient to patient. Any questions so far?
Mags, there is a question. So somebody is asking, why do strength training? Is there an extra benefit? Because I think in a previous slide you mentioned strength training twice a week.
Yeah, this is a really good question, especially since the ADA does specifically outline the call for resistance or strength training exercise at least 2 to 3 days per week. So one of the biggest benefits for strength training is that it's really helpful and beneficial for bone health. Because I'm in endocrine, I also do see patients with osteoporosis. And one of the recommendations that we do have is routine weight-bearing activity, and also the big one is resistance or strength training exercise. And so this type of exercise is really beneficial for optimizing bone mineral density. What we have also found is strength training or resistance exercise can also increase lean muscle mass and decrease abdominal adipose or fatty tissue in the abdominal region, which can also help improve insulin sensitivity. And the big thing is what we've seen in studies, decrease insulin resistance. That's a really great question. Thank you for bringing it up. I guess I'll go ahead and move on if there's no other questions, but of course, let me know if anything else comes up. And so I do want to talk a little bit about how exercise impacts glucose. Because various types of exercise will impact our blood sugar or glucose differently. So here is a really nice illustration that talks a little bit about how glucose responds over time to various types of exercise. And so the lower blue part is reflective of our blood glucose dropping, while the upper part of the chart that is in red reflects blood glucose rising. And then this shows the effect over time. And so in particular, at the lower part, you'll see aerobic exercise or activity, cardiovascular activity, such as running, walking, biking, hiking. All of this is considered aerobic exercise. And so this is actually going to cause our blood sugar to drop over time. Interestingly, anaerobic activity, resistance training, strength training, what I talked a little bit about earlier, HIIT training, high intensity interval training also. All of this is actually going to cause the blood sugar to rise, which is a very interesting phenomenon because often we do hear that exercise cause our blood sugar to drop, which is something that's really important, and I'll talk a little bit more about that. But it is interesting to hear that the glucose will actually rise from various types of exercise. And the reason for this is what happens with strength training or resistance training is that your body is actually breaking down muscle. And this also includes the breakdown of this molecule called glycogen. And glycogen is essentially stored in our muscles, and our muscles need glycogen to fuel and feed themselves, especially during exercise. But the breakdown of glycogen also causes the release of glucose, which will cause our glucose to rise. It also stimulates this process called gluconeogenesis, where hormones like glucagon are produced while strength training. And this tells our liver to release its own stored glycogen, which is eventually converted into glucose. Just to talk a little bit about the physiology behind it. But essentially, take-home point here is that different types of exercise will cause blood sugar to respond differently. Safety point with the aerobic exercise is because it does have the potential to cause low blood sugar, really, really important to monitor your blood sugar before, during, and after exercise. It's also kind of a nice learning point. It's really nice to learn about our bodies and learn about how exercise impacts our blood sugar, but really important to closely monitor. If you're going into exercise with a blood sugar, usually say less than 90, we usually say have a snack before exercising. And then if you are finding that your blood sugar is dropping, you're having symptoms of low blood sugar, feeling sweaty, confused, lightheaded, really hungry, any of the classic symptoms, really important to check your blood sugar. And if it is low, less than 70 or even less than 100 to play it safe, you may want to take a break in exercise and certainly have a snack to try to bring the glucose up. Okay, and so this is just a question that I would like all of you to think about, especially during the pandemic, because exercise is often impacted by, oops, let me go back to my screen one moment. Yeah, and so this is essentially a question that I want all of you to think about. How has the pandemic impacted how you exercise? For me personally, I was really into going to the gym and exercising outside of my home. But since the pandemic and just the closure of gyms, I've been trying to be more creative and exercise within my home, and then also trying to run on the local trails. Being creative with home equipment, like For example, one of my patients shared with me that she's using like water jugs to almost use as a form of weight. Um, and so getting creative with the way we exercise during the sheltering in place it can be kind of a fun way to incorporate exercise into our daily routine. And so I do just want to share some tools that we can use to increase daily physical exercise, even if we're not going out running a marathon. There's a lot of really great ways to try to track our activity and make sure that we are decreasing sedentary lifestyle, sitting for too long. Some nice tools are even just a simple pedometer that keeps track of our steps per day. A lot of the wearable devices, uh, Android, Apple phone, Fitbits, all of those can also track your activity. There's also reminders that you can set if you've been sitting for too long, so that the tool will vibrate if you haven't stood up for a while. So it's kind of a nice reminder. Oh, I've been sitting for this many minutes. Maybe I should take a quick break and stand up and do a stretch. So a lot of really great tools out there. I encourage you to explore these options and see what works best for you. There's also, with some of the apps out there, you can have a friendly competition with a friend. I used to use a Fitbit, and I know that you can compete with other Fitbit users by essentially competing on who gets the most steps in any given day. And I imagine a lot of other tools out there have a similar feature. And so it's kind of a fun way to encourage yourself to increase activity. As I already mentioned, there's apps out there where you can set stand reminders to remind you if you've been sitting for too long. And then this is just kind of a nice summary of some simple recommendations that may help incorporate increased physical activity into our daily routine. Some of the classic ones that are that can be easy to implement is, for example, taking the stairs instead of the elevator. Parking farther away from your front door, or if you're going grocery shopping, maybe not parking so close to the market. And also just, I think the most important thing is choosing something that is enjoyable for you. If you do enjoy an activity, you're more likely to make a habit out of it and really incorporate it into your daily routine. So really trying to do something that you enjoy and get some pleasure out of. But these are just some nice tips to review.
Mags, we have another question in the chat box.
Oh yeah,
somebody
go for
is
it.
asking, how many minutes do they have to exercise at one given time to have a benefit on their blood sugar?
Yeah, that's another really great question. And so usually per the guidelines, we usually recommend sessions for about 30 minutes, aiming for 30 minutes of duration of exercise. But of course, if you're new to exercise, or if you have a really busy lifestyle, working full time, raising your family, maybe 30 minutes at any given time is not feasible. And so just per ADA, some exercise is better than nothing at all. And so if starting slow with a lower amount of duration is more attainable for you, 10-minute walk instead of 30-minute walk, and then gradually increasing it, of course, as tolerated. Yeah, but I mean, generally 30 minutes, but I personally feel that it's important to do what is attainable and realistic. And so if that's 10 minutes a day, that's better than nothing. This is just another question for reflection. What types of exercise have you been doing during the shelter in place? So just something to think about, since all of our lives are have naturally been very affected by the pandemic, including our exercise routine. And so I did talk a little bit about this, but not all of us have take-home gyms in our living room. And so if you don't have any equipment at home, no problem. There's a lot of creative ways where you can try to use things you already have at home as equipment for exercise. For example, for resistance or strength training, soup cans, water bottles, water jugs, even heavy backpacks. This is a bit extreme, but furniture, if you're able to safely lift it. All of this can be modified as weights. And so there's a lot of things that are just sitting in our home that we can use for exercise without having to go out and purchase equipment. The next few slides just share some resources for various apps and channels that we can use for exercise classes, especially ones at home where we don't have to leave the house. And so this particular page does talk a little bit about some free YouTube exercise channels that some of you may find beneficial. There's also some free exercise apps out there. This also lists a few that you may want to look into. And then this also includes a bit more about free YouTube exercise channels. And these slides essentially outline various forms of exercise. And so I just really encourage you to see what resources are out there and find something that works best for you, that you enjoy. Let's see, just some more information on various apps that are out there. Yeah, and just another question of reflection. Have you ever tried any of these apps or YouTube exercise videos? How did it go? Did you enjoy it? How did it feel? Was it something that you think you would do on a daily basis, or multiple times throughout the week? Maybe if you're trying to incorporate like a variety of exercise, maybe download a few of these apps to play around with. A yoga app, a strength training app, resistance training, or cardiovascular exercise. Just I think my main point is to try to play around with these various apps and tools that are out there in our virtual world and see what works best for you. And so as we try to create our exercise plan, especially if this is new to us, these are just some questions that would be good to consider when creating a plan. Why do I exercise? What are the benefits? What are the barriers to exercising? What time of the day do I prefer to exercise? Maybe this is something that you'll discover with time. Maybe you find that exercising in the evening after work is just too exhausting, but you really are much more, you enjoy it much more, and you're more likely to stick with it when it's in the morning. And so that even when you're creating a plan, but not only during the plan creation, but also implementation, these are good things to consider. Also, how much time do I have most days? Is maybe the 30-minute goal a little bit unattainable? Maybe a good goal would be 15 minutes once a day after a meal. And so just definitely, I encourage you to reflect a bit as you start to incorporate exercise into your routine. And then I talked a little bit about this already, but as I mentioned, certain types of exercise, in particular aerobic exercise, has a really high risk of low blood sugar. The highest risk is usually 6 to 12 hours after exercising, especially if you're on insulin therapy as treatment. And the reason for this is because it can increase insulin sensitivity, where your body is responding more effectively to insulin. And so if your blood sugar is less than 100 before exercising, we really recommend having a snack and waiting 30 minutes before rechecking. Having a snack, rechecking the blood sugar 15 minutes, and again 30 minutes to make sure it's stable. Because we don't want you to exercise if blood sugar is less than 100, because there is the potential that it'll just drop further. And then in general, just the best time to exercise is 1 to 3 hours after eating, as this is when your blood sugar is most likely to be the highest from that particular meal. And then just continuing to closely monitor your blood sugar throughout exercise. It is a bit of a learning process, so seeing how your body responds to various types of exercises and when you're most prone to this risk of low blood sugar. Just something to be very aware of. I really encourage you to monitor blood sugar while you're exercising, especially in the beginning stages, but this is all very new.
Max, there's just one more question. Somebody in the audience is actually asking, what would you consider a low blood sugar?
Yeah, that's a really great question. And so per AGA, anything less than 70 is considered hypoglycemia. And so really going by the books, anything less than 70 is considered low blood sugar. And so this rule of 15 that I have here is a recommendation on what to do if you do have a blood sugar less than 70. But of course, if you are going into exercise with a blood sugar less than 100, especially exercise that is known to cause low blood sugar, we really recommend having a snack and waiting 30 minutes because there is the potential that you will drop to that danger zone of 70 or less. And so this talks a little bit about proper treatment of low blood sugar, hypoglycemia. We like to call it the rule of 15. And so essentially what we recommend is eating or drinking 15 grams of fast-acting glucose. And so some really great forms are just glucose tablets that you can purchase from your local pharmacy, a gel tube that actually is like gel glucose, 4 ounces of juice, let's see, I'm brainstorming what else. 1 tablespoon of sugar, honey, even gummy bears. If you do end up like getting gummy bears, you can buy a big jug, but then we recommend measuring out little emergency packets so that you know how many carbohydrates, how many grams of carbs are in each gummy bear, and you're adding up to 15 approximately. What can happen is sometimes overcorrection of low blood sugar where we understandably panic. And so perhaps we treat it with more than 15 grams of carbohydrates. So we can notice this low blood sugar followed by this blood sugar that's above target. And so really what we recommend is treating with 15 grams of fast-acting carbohydrate, waiting 15 minutes, rechecking the blood sugar. If it's still less than 70, you'll have to go through this whole process again. And we want you to continue until blood sugar is above 70. Let's see. And I believe this is one of my last slides. I really like this slide and it's very close to my heart. It's essentially a mental health guide to coping with lockdown in the winter, especially with the pandemic. These can be very challenging times. And so these are just some strategies, not only does it talk about exercise and the importance of staying active, but other ways that we can improve mental health during lockdown. Such as ensuring that we have adequate lighting in our house, we're staying connected even virtually with friends and family, helping others, planning our week, and organizing what we have ahead of us can also help us provide us with a sense of pleasure and achievement. So this is kind of a nice summary that I thought might be useful. I think that's all for today. Any other questions or comments before we conclude this presentation?
Yeah, we have another question, Mag. Somebody is asking if you would consider gardening as part of exercise for people living with diabetes.
That's a great question. Absolutely. Gardening is a really great form of exercise. It actually could be considered both aerobic and anaerobic because gardening often incorporates like lifting heavy objects such as bags of soil, pots, but also physically we're doing a lot of mobility. And so I would consider it both resistance and aerobic exercise. And I think it's a really great form of exercise. I do know with the pandemic, a lot of us are actually taking up gardening. And it's a really fun hobby and it's also very beneficial for our health. So absolutely, that's a great form of exercise for diabetes.
Great. And I think there's just one more question. Somebody is asking if when they're exercising, they have to exercise until they're out of breath, or is it okay to exercise and still not be out of breath for the benefits?
Yeah, that's a good question. I would say it's very individualized. I would probably, I'd say I would do as, being out of breath and having a more rapid heart rate is a sign that we're performing aerobic exercise. But of course, we don't want you to overexceed what we're capable of. And so I think one of the best things to do is try to monitor our heart rate. And if you're finding that the amount of exercise that you're able to tolerate or you want to start off with isn't necessarily causing you to feel out of breath, that's okay. Better to start small and gradually increase the amount of exercise that we're doing as tolerated. And so like, as I mentioned, the goal is for a duration of 30 minutes, 5 days per week if we're going for that 150-minute per week goal. But if you're finding that respiratory wise, you're just not able to tolerate the 30-minute sessions, that's okay, even if it's not necessarily causing you to feel out of breath. And some exercise is better than none at all.
Great, thank you. Oh, and actually there's somebody, Max, who commented on one of your slides around how the pandemic is affecting their exercise. And they actually said that the one positive is they actually are now more active with family members versus being active individually. So I think maybe that's a positive thing one of our participants has been able to share. I don't see any other questions. So I think we can just close this out. We appreciate your time and your expertise so much, Mag. Thank you so much for speaking with us tonight and teaching us about exercise. And thank you all for tuning into our diabetes wellness group. And next month, we're excited to hear from Jessica Shipley around healthy cooking, fast breakfast ideas. So thank you all. Until next month. Bye-bye.
Bye.